Thank you, and apologies for the delay, colleagues. First, a very bad network connection here, but I would like to thank you all, colleagues, just like I was mentioning earlier, for tuning in. And also, we want to appreciate uh,
Good afternoon, everyone. Can I just have a couple of minutes and then I'll be all set up? Thank you. Okay, sorry for the delays. Good afternoon, everyone. I hope I'm audible enough. I believe I can start now.
Yes, you are audible.
Thank you. Okay, Bongani will be sharing will be moving the slides as I'll be presenting. My name is Nomathemba Dube from Eswatini Health Laboratory Services under the National Quality Assurance Unit Lab. Today we'll be talking about laboratory ethics, impartiality, and confidentiality. We just want to explore the ethical principles that guide our clinical practice and ensure that we build patient trust whilst we are doing our quality diagnostic services. So the objectives of our presentation today will mainly focus on our alignment with our ISO standard, which we are using in our labs, the 15189 mostly. For the 17043, we've then decided that we will do it on our next presentation, which will not be covered in today. Also, our ethics foundation, getting to know how ethics came about and why we have to conform to the principles around ethics. Impartiality is not something independent from ethics, but it looks at the unbiasedness of laboratory personnel at large in our day-to-day operations and how we manage conflicts of interests. And then, most importantly, we will then talk about the confidentiality protection, making sure that our patient integrity, data, and their privacy are well upheld, and we do not leak any unnecessary information or share any unnecessary information with others who are not authorized to have. So, welcome to this presentation. So what does the standard ISO 15189 say about ethics? We have a provision in the 2022 version, section 4, on ethical conduct, expectations for clinical laboratories. And the standards are the foundation for maintaining a professional integrity and creating patient trust, competency, and integrity. Our laboratories must avoid any activities that would diminish confidence in their practice, impartiality, judgment, or operational integrity. So laboratories should have actually systems in place to ensure these ethical standards are upheld. And you as a laboratory personnel or an affiliate, being maybe some people in other cadres who do actual testing, be it POCT or any other test, we have a duty as professionals to ensure active application of these ethical standards or consideration. So even in the case of audits, integrity is to be upheld as well. So what we usually the practice or the culture of having to prepare, for an audit while falsifying some documents, per se. So yes, we need to be upholding the integrity of our activities as we do our day-to-day activities. Freedom from pressure. Management and personnel of the laboratory must remain free from commercial, financial, or other pressures that could adversely affect quality of work. Your quality of work should not be altered by pressure from a client who has paid more than they should to get their results stat. Trying to push to the front, so you find that a client now offers some monetary compensation. We have to treat all our patients as prescribed by our policy or quality manual. Treat all patients as important. Also, management may have the privilege, can you still go back, Bongani? Management may have the privilege of being involved in selecting vendors to supply EMA laboratories to. Their decision should not in any way be a stumbling block in the application and maintenance of integrity of our laboratories. Also, whoever is in a position that will project a conflict of interest, they should openly declare to the appropriate authorities so that they are covered in terms of conflict of interest. They must declare their conflicts. And also, ethical considerations are also in our sample handling. Appropriate procedures, we must ensure that we treat human samples, tissues, or remains of samples according to our legal requirements. So now, where do ethics really come from? We can go to the next slide. In the Declaration of Geneva in 1948, shortly after the World War II, there was a convening in Switzerland, Geneva, where medical professionals were addressing some of ethical observations that I've seen during their time in the field. So this is where this declaration was made. It is not per se an oath, but it is a pledge for medical professionals to say that we want to will uphold integrity, honor, cause no harm, and all that into the profession, and making sure that our patient health is of utmost importance. So ethics really do form the cornerstone of laboratory practice, guiding every decision and action taken in the pursuit of accurate, reliable diagnostic services. Ethical conduct ensures that laboratory professionals maintain the highest standards of integrity. So while it was intended primarily for physicians, its ethical principles were and are very relevant in our medical laboratory profession. So as professionals, we should uphold the honor of this profession. We should respect the rights and dignity of all our patients, maintain strict confidentiality regarding patient information and lab findings. We should not allow personal bias, profit, or external pressure to influence professional judgment or quality of work. And we should continue to update our knowledge and skills, and recognize that it is our responsibility as professionals to remain competent in a field that is rapidly evolving, especially with science and technology. We are to also respect our seniors, our colleagues, and other healthcare professionals, which will help us foster teamwork and communication in the best interest of our patients. We are to also uphold public trust in the medical laboratory profession. Now, the core ethical principles, the core ethical principles that we are going to look at are autonomy, beneficence, non-maleficence, and justice. These core ethical principles derive from the Hippocratic Oath, as well as the Declaration of Geneva. So autonomy is all about respecting the patient, respecting the next person. We recognize that our patients also have a right to self-determination and be informed, then voluntarily do healthcare decision or make healthcare decisions. So in the laboratories, this includes obtaining proper informed consent for testing and respecting the choices of the patient regarding their care. Beneficence is the act of duty in the patient's best interest by maximizing benefits and doing good. Laboratory staff must provide accurate, reliable, and high quality service that contribute to diagnosis and effective treatments. Non-maleficence literally just means we do no harm. Whatever we do, we make sure that the patient is free from risk, or at least all risks are minimized while we perform our daily duties. We have to maintain a strict quality control protocol and promptly communicate should there be a need or any adverse accounts. In our case, we usually then report critical values. So we have to have those established protocols on how we go about doing that. Justice, we treat all our patients equally, and we distribute the resources to benefit or the resources and benefits so that every patient is equally or in equity benefits from our activities. We do not encourage, we actually prohibit discrimination based on race, ethnicity, religion, socioeconomic status, or any other non-medical factors. So why do we need ethics? Do we even really need laboratory ethics? Yes, we do need ethics. Patient safety depends on our ethical practice. The public trusts requires that we uphold ethical standards, and yes, professional integrity, and it demands ethical conduct. Next. So we're going to discuss the ethical considerations in the three categories or the three stages that we have in the lab. We have pre-examination, examination, and post-examination. In pre-examination, this phase presents critical ethical considerations that require collaborative responsibilities between the lab, the healthcare providers, if we have researchers, yes, and specimen collection personnel, because we do understand that it's not in all facilities where specimen collection is just designated to a certain group of people. In other facilities, we have also the other cadres who also collect blood, especially in the wards and other places. So proper protocols should be in place to ensure the safety and patient safety and sample integrity from the very beginning. We do know that garbage in is equals to garbage out. So patient identification, proper identification of our patient or subject in the case of research, using at least 2 unique identifiers, we should be able to see or know who this patient that we are collecting from is. Appropriate collection is quite important as well, as we are to use the correct technique for collection, the right time for collection, methodology also should be specified for each test. Our samples must be labeled with the appropriate identifiers, both the sample and whatever sticker or label that you put on top of a sample, but you must ensure that correct labeling of all samples is done at the pre-examination phase. Specimen handling, we are to appropriately handle and store our specimens until testing is performed, so that we maintain the sample integrity and prevent degradation. I think I remember one occurrence where a batch of samples in purple tubs were placed instead of a refrigerator. They were placed at -40 some year when we are doing some study. So it's one of those things that you then have to think. You would see what about the patient or the participant of that study having had gone through all the procedures of having their blood taken only for that sample to be discarded because of inappropriate storage. Autonomy. Informed consent is a requirement, and it is supposed to be made for each and every sample received in the laboratory. So consent should be informed and may be either expressed or implied depending on the clinical situation and the type of testing being performed. When we say expressed consent, we mean that a patient is asked for written or verbal agreement for specific procedure or testing. I think this would apply to when FNA, fine nuclear aspirate, is being taken from a patient in the laboratory. Yes, and then implied consent is when a patient provides a requisition. In our case, we receive request forms, request forms, which we then take that as a consent from the patient, because they are the ones coming with the request form to the laboratory for their samples to be taken. And then special considerations may be informed consent may pose ethical challenges when patients are incompetent to make decisions due to their age, mental status, or critical illness. Hence, alternative consent mechanisms may be established. In this case, in the case of age, because a 5-year-old cannot really consent, but their guardian or parent will always be there to consent on their behalf. Confidentiality must be maintained at every step, including specimen transportation and data entry. Patient demographics and test details should only be shared with the appropriate personnel. Beneficence. Evidence-based testing. All tests that are made in the laboratory should benefit the patient based on the best available medical evidence and clinical guidelines. We do not just test for the sake of doing a witch hunt, which is why patient history is rather important when we are doing test requests and doing our testing, because it will give us guidance on which route to take when doing further testing or our investigations. Safety protocol procedures are to be enforced, and trained personnel must also be there to prevent adverse events during collection of procedures. It is important that laboratories provide our clients, our patients. It is important that laboratories provide our clients and patients with trained and competent personnel so that we do not cause harm to our clients and patients. Universal precautions should always be in place, and people should, or healthcare professionals should be aware and be taught about them to protect themselves as well as the patients. Ethical research. Specimens for research require informed consent to the participants and approval from the ethics board. Proper labeling with at least two unique identifiers and appropriate transport methods preserve the sample integrity, because it is important that samples reach the laboratory or the testing bench as stable as they should. Justice. Accessible testing. We should provide, as laboratories, we should provide access to a wide variety of laboratory tests at reasonable costs to ensure a wide variety of laboratory tests. Providing access to wide variety of laboratory tests at reasonable cost ensures equitability, healthcare delivery for all our populations. We do not discriminate because of socio-economic status of an individual. Test menu evaluation. We are to periodically review our test menu having in mind the different developments that are occurring in our everyday science and innovation life. So we have to reevaluate if these specific tests are benefiting the patient or they are no longer serving the purpose. So if there's a more sophisticated test, which is also more affordable, we can just jump into that rather than having to go the traditional route of testing up until we get to the right test that we should have initially have done in the first place. Equal treatment. No preference should be given to individuals to facilitate or expedite the collection process at the expense of other patients waiting for service. We do know that in our practice we have our VIP guests, we have our relatives, but that the patients who've been in the line for quite some time. Now in the examination phase, confidentiality. We will forever emphasize confidentiality. Maintaining confidentiality during this phase is important, even though it's almost a byproduct of automation. But it is something that we should also take note, which is why we have to make sure that people who have access to the analyzers that we use, to the LIS that we use, are people who are authorized to have privilege to that information. Smaller laboratory considerations. The challenge of maintaining a confidentiality during the analytical phase are often greater here, because most of the laboratories, you may find that they perform manual testing, where individual when an individual receives samples, there is more direct human handling. So while you are doing your sample testing there, then there's somebody who probably was not supposed to see that because they're not assigned to that sample, but because it is just on that working bench there to that information. Autonomy in examination. Confidentiality should be respected and maintained throughout testing. In POCT, special care must be taken to maintain confidentiality as much as possible in less controlled environments. We may find that it is easier when you have a long queue when you're doing your POCT and then you just want to batch your results. But you should make sure that, one, we do not mix match the results from the patients, and also other patients shouldn't see the next patient's results. Patients retain the right to decline to have their specimens analyzed, even after specimen has been collected and received in the laboratory, and there should be clear protocols for such requests. Good laboratory practice involves establishing rigorous quality assurance programs and encompassing quality control testing, which must be done religiously, proficiency testing, which every laboratory must participate in, and laboratory accreditation, which is our goal, our end goal, and maintaining accreditation. These comprehensive quality systems, they should ensure that patients receive accurate, reliable results and contribute to appropriate medical decisions and treatments. Justice in the examination phase ensures fair and equitable treatment for all patient samples, regardless of patient characteristics. All patient samples must be treated equally. We do not discriminate based on all the things that we've mentioned prior. Also, priority testing protocols. The laboratory should have a documented policy which will state how we handle stat or priority testing, and clearly state which tests are to be included in that stat or priority testing profile, and what are the expected turnaround times. And these are to be communicated as well to the clients, being the clinicians, and also to our patients who are waiting for their samples. Because some patients will then ask, but this one came after me, but how come they are getting their results earlier than I do? All those things, we need to build trust with our patients, and then we inform them of the priority testing that we have established with good reasoning. Then time analysis of specimens should be analyzed accurately and in a timely manner, with consistent standards being applied to all patients. Now, when we get to the records and the results and the reports, post-examination phase involves critical decisions about reporting, record retention, ongoing use of patient specimens and data. Proper archiving and access controls are essential components of ethical laboratory practice. Request forms, original tests, requisitions, must be archived with appropriate security measures and retention schedules. Raw analytical and quality control data require secure storage for traceability and potential review. Results and reports. The final results and reports must be archived in formats that ensure long-term accessibility and integrity. Identification of authorized personnel allowed to access medical records should be clearly documented in the policy manual. Next. So the key principles: autonomy. Patients have reasonable expectation that their samples will be solely used for laboratory testing requested by the clinicians. So individuals have the right to decide when and if their records or specimens shall be used outside the normal medical care to which they have consented. Any further testing or residual samples should be approved by local ethics committee or institutional review boards, and patient consent may be required in some cases. Results should be reported so that patients, clinicians receive the right results within appropriate time with information allowing correct interpretation. Misinterpretation of the test results may result in patient harm, which is something that we are trying to avoid, which is why we require a clear and complete report system. It shouldn't just make sense to the one who is performing the test, but also the clinician who requested the test should understand what is entailed in the report. Turnaround time should be as short as possible based on the laboratory conditions, but we should not compromise the validity of the results. Next. Consistent reporting. Excuse me. The reporting of results should be consistent for all patients using standardized formats, reference ranges, interpretive comments, regardless of patients' demographics and insurance status. In some cases, it can be medical aid status. Rapid reporting should be available whenever required in special cases, such as critical values or emergency situations, with clear protocols for prioritization. And financial considerations, withholding of laboratory results because the patient has not paid should be avoided, as this can compromise patient care and violate the principles of medical ethics. Financial barriers should not prevent patients from receiving their next. We're about to finish.
Yabaleka isound.
Now, the importance of ethical principles. I'm just looking at these new drawings, lines that we have. Importance of ethical principles. Why do we apply ourselves, and why do we adopt ethical principles in our profession? We want to enhance patient care. Trustworthy and unbiased results are crucial for accurate diagnosis and effective patient care, directly impacting the outcome of treatment and patient safety, which is basically our core mandate, to make sure that physicians, clinicians, they all make the right decisions for patient treatment and monitoring, ensuring compliance, adhering to ethical principles, relevant standards such as 15189 ISO, making sure that our laboratories, they meet the legal and professional requirements. Also, it is important for us to build trust with our clients. Upholding impartiality and confidentiality builds essential trust among our patients, healthcare providers, and the public at large, that our laboratory provides reliable services. So these principles are the foundation of the professional laboratory practice and are essential for maintaining integrity in quality of care. Implementation strategies. We are to develop clear policies. It shouldn't just be in the ISO standard, but we should also then adopt it into our daily practices. It should be documented, and we must commit into implementing these strategies. So a policy should address all the aspects of laboratory operations from pre to post. Ensure that we have our staff trained regularly, keep them on ongoing educational programs to ensure that everybody understands and can apply the ethical principles in their day-to-day work. We should also establish a monitoring system to regularly review and assess adherence to ethical standards and identify areas of improvement. Also then create channels for reporting ethical concerns, receiving feedback from staff, patients, and healthcare providers. I know that usually we focus more on the actual testing, the actual procedures that we do in the laboratory, but I do wish and believe that if we also look into the application of the systems in terms of ethical considerations, how knowledgeable are we, how we apply ourselves, how we uphold ourselves, the profession, and all that. I really wish that maybe we can come up with something that can assist us in the continuous monitoring of such systems. Next. So how can we measure our ethical performance? All our tests that we perform in the lab should be consented 100%. We shouldn't have a test that is performed in our laboratories that has not been consented. So it should be informed consent or implied consent, either of the two, but we should be able to prove that it was consented. And we do not expect any breach of confidentiality amongst our professionals. Hence, we do not expect anything above 0. Also, the number of hours that are dedicated to ethics training should be nothing less than 24 hours per year, whereby we just go through as the ethical consideration or the ethical principles as professionals to help ourselves in doing our day-to-day work. So assessment methods that could be used are the regular ethics audits and assessments, patient satisfaction surveys regarding privacy and confidentiality, not just their TATs and the likes, but patient confidentiality and their private data privacy, staff competency evaluations on ethical decision making, incident reporting and analysis, systems, peer review and professional feedback. We are each other's brothers keepers, so we are able to also peer review and give professional feedback to one another. So if we can just probably look at how best we can use this assessment methods, we don't necessarily have to apply all of them at once, but we can just select a few on those. Thank you. Next. Ethics as a foundation. Coming to a conclusion that laboratory ethics, impartiality, and confidentiality are not optional. They are not optional. They are the fundamental pillars upon which all reliable lab services are built. These principles ensure that patients receive accurate, trustworthy results while maintaining their dignity and privacy throughout the testing process. We should pride ourselves in professional excellence. Ethical practice distinguishes professional laboratories and builds lasting relationships with healthcare providers and patients. Patient safety. We should ensure patient safety by adhering to ethical principles which directly contribute to patient safety and optimal healthcare outcomes. The industry requires us that we uphold ethical considerations as stated in ISO 15189 requirements. And also for professional recognition, we are to be perceived as laboratories that uphold ethical standards, and we carry ourselves with dignity and integrity. So we must embrace these ethical principles, and laboratory professionals should contribute to a healthcare system which is built on trust, integrity, and excellence in patient care. Thank you so much, team, colleagues, on listening on our short presentation. I would just want to also add that this presentation does not really cover everything that ethical consideration has to cover in our field. I think in our next session we will look at ethical consideration in digital spaces, because we now have our social medias, we now have platforms where we have the freedom to share knowledge. I think we just need to consider the guiding principles that play around that, on how we are to handle ourselves, even if it's just for educational purposes. You feel like you just want to educate the public or the space that you're in on certain topics concerning laboratory practice. I think we will discuss all that in the next session of ethical considerations in digital spaces. Well, thank you so much for having me. If you have any questions, Bongani had said on a challenge with a network. I'm not sure if he'll be able to say something now.
All right. Thank you so much, Quality Assurance Unit, for the EHLS as a CPD provider for this session. And thank you so much, Namatem, for the presentation on this very important aspect of our CME, which is the first part of the ethics in our CME series. Am I audible?
Yes, you are very audible.
Okay, thank you so much. Colleagues, maybe I just want to also thank you for your patience. I think connecting here was kind of difficult for me today. I was in a different space, which has no reliable internet. But I thank you all for tuning in. And likewise, I was mentioning earlier that we have a well-structured CME series, which we, by now, it's about 12 units, which are constituted by presenters from all over, from the diverse field. And I've tried to share with pretty much everybody through direct emails and all platforms through representatives as well. And I hope we can still share to everybody who's within the laboratory space, so that we can all learn and stay competent. And above that, we can still meet the requirements of our regulating body, the Medical and Dental Council. Just to add on that, we'll also be having a research club, which I'm still trying to put together. It will also have the same structure as the CME, whereby we'll be deliberating on research that is ongoing within the laboratory, and we'll rope in the ethics board just to make sure everything is streamlined with their policies as well. So that is coming into the CMEs and also the CPD platform. And on top of that, you will still have in-service trainings from any provider that will be facilitating them, either wherever we are. As long as we are professionals, we'll try our best that all trainings that we're getting should be in line with the CPD requirements. And then the regulator, the EMDC, will also be informed and also updated on your current achievement or learning. Then also the facility-based CMEs as well, will be pushing that also to make sure that we create more sessions for everybody to join. In conclusion, in our today's session, we usually create a quiz which acts as a register in some way for us to document who participated today. And if you can look into your chat box, I think through the EMDC lab, there's a Google form link. Can you follow that, colleagues, but if you can still, you can also copy the QR code on the screen. It's just a 10 question quiz, but mostly we just want to capture the demographics to say who joined today's session, and then you can just answer those 5 multiple choice questions, and then after a while you'll get a certificate of participation, just like we were doing before. And I think the turnaround time would be less than a week, I guess, but we'll try our best to speed track that as well for each and every session that we're having today. So colleagues, in the absentia of any other updates, I also saw that we had a question in the chat box. This one came from Joseph. I'm not sure if Numatemba is still in a good position to still comment and answer the question. He asked that, good day, chair lady. Please, I want to ask, in case of patient consent is inconsistent to sign the form, what do you do? And maybe after this, we can open any other question that we're having, maybe simultaneously still completing the form on the chat box. Noma, over to you and the quality team.
Thank you, Bongani. He wants to understand, in the case the patient is unable to sign the form, what do they do? Okay, from the top of my head and understanding, it's not always whether the patient signs the form. Usually, in our case, it's the doctor who's making the request. We, knowing that the doctor has assessed that patient and made his clinical consideration on which test he needs on that patient. So by the patient bringing the form, the request form to the laboratory, it does mean that they are now they've consented, because they are the ones bringing the form into the laboratory for their bloods or whatever sample to be taken. Yeah, I think that's one. I don't know if Babedlamini Quality would have a different perspective on that. But I think Joseph does understand, or does he have a follow-up question? Hello?
Mr. Joseph, are you still there? Okay. Thanks, Dama. Colleagues, do you have any other questions related to today's session? Maybe not. Thank you so much, Noma. And colleagues, can we complete the quiz on the Google Form link, and also on the screen I have the QR code. You can copy, or just follow that link and just answer those few questions. It's just your name, EMDC number, and where you are based, and then maybe multiple choice questions. I think there are 5, then 10 all together, so we can document this session. Thank you so much, colleagues. I do hope.
Sorry.
Yes, no?
There's someone in the chat box who has asked, could see if they do not have the EMT number, how do they fill in the form? It seems like it's mandatory. I believe
okay.
probably it's a new entrant.
Okay. Thanks for that. We can just put zeros for now. We'll fix it later.
Oh, okay. Thank you.
Yeah. Just put zeros or any number for now. We'll fix it later. Thank you.
No.
Thank you, colleagues. This is the end of the session. I do hope we can join again on the next one. I think we'll skip a week and then we have another session again. Thank you all.
Bye.
Bye.
Take it up. Take it up. Take the bill up.
This is my passport now. It's not yours. This is not yours. You already have your own passport. This is mine.
Thank you.